Hello everyone, I'm Dr. Lilian Montalvo, board certified dermatologist, and I wanted to take a break from the coronavirus and start making videos to educate my patients. Right now, the whole world is in a lockdown and we might as well get educated. So what I wanted to talk to you about is the skincare routine order. I get asked all the time, but what do I put first? The moisturizer or the sunblock or the serum or the moisturizer? So I developed a very simple way to remember. There's so many things out there, too much stuff, too much information, too many products, too many brands, too many people trying to sell you things. Be smart and learn how to do this in a very simple way. So after giving it a little bit of thought, I came up with this mnemonic. Too much stuff, what I was saying, too many products, too many brands. So remember, too much stuff, TMS, and then this boils down to treat, moisturize, and sunblock and sun protect. See? Too much stuff, treat, moisturize, and sun protection. So what I'm trying to explain in a very simple way is the steps to follow after you wash your face. TMS, too much stuff. Treat, moisture, sunblock. You wash your face, you put your treatments, if you have any kind of condition, of course, treatments given by the dermatologist. Then you put the moisturizer, and I will explain the difference between the serums and the creams. And then you put the sunblock. After the sunblock, you're ready to apply your makeup. I will explain each one of these steps more carefully. So a very common question in my office, how many times do I wash my face? The answer is simple, twice a day. There are many well-done studies about this subject, and they all conclude the same. It doesn't matter if you have dry skin, combined, oily, acne, rosacea, dermatitis, twice a day is perfect. Regarding the types of products, if you have no idea, if you don't have any products, then you should look for products that say dermatology recommended. Usually what they mean is that they are hypoallergenic. That means that the chance of giving you an allergy are really low because they don't have that many ingredients. Usually these products are non-comedogenic. That means they won't clog your pores. And usually they're fragrance-free and no colorants or very few of these. Which means, bottom line, they're not very fancy, but they're very good for your skin. Okay, now we're ready to start the TMS, Treat, Moisture, and Sun Protection. I'm going to put this back so I don't look that weird. I don't need to do that. Okay, so a little trick for me, a dermatologist. Usually, people leave the eye cream for later on. I really recommend doing it right after you pat dry your face. Why? For two reasons. Number one, it's a very thin skin. It gets really dry. You can even feel it right after you wash your face and you dry it, how tense that area feels. So the faster you apply the cream, which is moisture under the eye, the better penetration. That's one reason. The second reason is that many of my patients use products to elongate their eyelashes. And if they put too much, and even if they don't put too much, they put it here, it's like a liquid, this kind of product, which is a liquid you put with a brush once a day to make your eyelashes grow and to make them thicker and darker. So even if you're very careful with that, it will go down to the lower part of the eyelid and to this area. And that will cause pigmentation. It can make your dark circles darker. And I even had a patient who's a friend that she used so much that she started growing hair here. She thought it was a pigmented spot. And then when I looked close, it was a bunch of hair growing as a side effect of these products. So To avoid that, I recommend that right after you shower, when that skin is super dry and tense and it feels like a dry cracker, you apply the eye cream. You apply it under the eye, all the way here and here. So if you apply the eyelash extension, it won't cause any harm. You don't need to put it on your upper eyelid. Why? Because sometimes these products can get into your eyes. They can make your blurry vision or your vision blurry, and they can sting, they can hurt. So if you have dry upper eyelids, I highly recommend the use of products like Vaseline or Aquaphor. After washing your face and applying the eye cream comes to treatment. Why? First, because you want the medication to go directly into your skin. So here's when I get asked many times, what about toners? So in summary, dermatologists, we're not very good friends with toners. I only recommend toner for people who are getting treatment for their brown spots. I recommend they use a flat cotton like this one. Apply the toner and go directly to the pigmented spots. To get that area, as I tell my patients, squeaky clean. We don't even want residues of the cleanser in order for the lightening creams to go and penetrate as much as possible. So if you have any conditions like acne, rosacea, dermatitis, please consult your dermatologist. I'm very concerned about people giving recommendations without any kind of degree, any kind of knowledge. They just want to sell you products, so be smart. I get many complaints from teenage parents, especially girls, about buying a bunch of stuff, spending a lot of money, and getting worse. So please consult your dermatologist. Save that money so when it comes to buying a good medication like Retin, you can afford it and don't spend it on all other stuff that is not good for you. After washing, eye cream, medication where it's needed, now it's moisture. And here's a little bit confusing between the serums and the moisturizers. You can use both because many serums are different from moisturizers because they have antioxidants to prevent your skin from getting damaged from the sun. Some of them have lightening materials like vitamin C. So how can you remember what to use first? Okay, first you use the lighter products with the less color, the more transparent. Those are the serums. And after the serums, you apply the heavier products with the more opaque looking color, which are the cream, the moisturizers. Finally, completing the TMS mnemonic, Treat, Moisture, Sun Protection, it's time for the sun protection. And why is that so important? Why do dermatologists insist on people wearing sunblock? Well, there are three main reasons. Number one, it's anti-cancer. The ultraviolet, the UV rays from the sun, cause mutations on our skin, and those mutations lead to cancer, and that is proven by many studies. Another reason is anti-aging. Over 90% of the aging in our face is caused by those ultraviolet rays from the sun. And the third reason for sunblock is to make those brown spots lighten and to help the treatments to lighten them work. There is no way you're gonna make your brown spots better if you don't apply sunblock. And what are my recommendations as a dermatologist? SPF 50 or more. Over 50 is very similar, basically the same. So as long as it says 50 SPF or over, it's okay. Also, dermatology recommended products, remember that means that it will be non-comedogenic. That means it won't clog your pores, and it's going to be hypoallergenic. That means that the chance of giving you an allergy are really slow. So what about the exfoliants, the masks, and there's so many products that people are buying, and some people are recommending and selling over blogs and videos like this one. Well, you can do the exfoliation if you have normal skin and you don't have any kind of condition. You can do it once a week after you wash your face. Regarding the masks, I do not recommend any masks. I'm getting many complaints from teenage parents of especially girls buying all kinds of masks from people that do not have the knowledge. Listen, for me to be a dermatologist, after I went to college and studied biology as a major, I did 4 years in med school, and then I studied 4 more years to become a dermatologist. When we study to be a doctor, and then we study to be a dermatologist, everything that we study is evidence-based. Means we have to read studies, and whatever comes from analyzing all the studies is what we recommend. It's not whatever my neighbor gave me, or what looks pretty in the store, or what the YouTuber told me. Please be smart about this, and if you have any doubts, don't buy anything. Ask your dermatologist. That's what we're here for. Okay, I got a little bit emotional there, but it's my attempt to help you, to educate you, not to sell you anything. So please be smart about that. And now let's summarize what we learned today. And it's the steps of the skincare routine in a very simple way. Remember, I taught you the mnemonic. TMS, TMS. Too much stuff. Too many people trying to sell you things, too many brands, too much. So too much stuff. So remember, too much stuff, TMS. What about the TMS? Treat, moisture, and sun protection. Let's write it down. When you see it, it will stick in your brain. Treat, moisture, and sun protect. This is a very simple way to remember there the steps of your skincare routine every day after you wash, of course. So I didn't write wash because that's pretty obvious. So I really hope this helps. It's my wish to help you. And you can help me by liking the video, by asking me questions, giving me suggestions. You can subscribe if you like. If you learn anything, I will keep making videos to educate my patients and anyone who can benefit out of this. And hit the bell button to get notifications of new videos. Bye. Oops, I forgot to tell you. I really hope you learned something from this video. And in order to give some people that are very lost an idea of a few different brands, I don't have any preference. As a doctor, first do no harm. I'm going to include the links of a few products and brands so you have an idea. I'm going to give you choices for cleansers, for moisturizers, and from sunblocks. The ones that I recommend the most in my office. As I said before, I'm not sponsored. I don't get paid anything for this. My wish is to help you. I really hope you learn. I always wanted to be a teacher, and I'm getting my dream come true by doing this. Bye.